Hi, I'm Dr. Brian Worden. I'm a Stanford-trained ear, nose, and throat specialist. I've been in practice for 15 years, and today we're going to discuss the 3 most common factors that tend to make tinnitus worse. But first, let's take a step back and remind ourselves that for the vast majority of people, tinnitus is a phantom sound perception that is not dangerous in any way, although it can be very bothersome and annoying. In fact, for the majority of people that experience tinnitus, their brains are able to recognize that this tinnitus signal is neither important nor dangerous, and their brains tune it out from their conscious awareness so it does not persist as a bothersome perception. But for some, through no fault of their own, their brains mistakenly designate the tinnitus perception as something that is potentially threatening and worthy of more constant monitoring. And for those people, the tinnitus persists and it often triggers a bothersome stress response within the body. So really our goal in treating people that have persistent bothersome tinnitus is to try to encourage some healthy changes in the brain biology so that it's easier for the brain to identify the tinnitus signal as something that's neither threatening nor important, and make it easier for the brain to tune out the tinnitus perception. And for most of our patients, this process is very successful. So, the first factor that tends to make tinnitus worse in people is stress. When our body's stress response system is in overdrive, our brains are in survival mode, and the brain is hypervigilant, scanning the environment for any potential threats and dangers. And in this circumstance, the brain is much more likely to identify any particular perception or sensation as something that is potentially dangerous or threatening, and this includes our tinnitus. So in order for our brain to be in the right condition for tuning out the tinnitus perception, we really have to down-regulate the overactive stress response system. So what kind of things can we do to reduce the stress response? Well, first of all, I encourage people to do a regular exercise program. I encourage people to practice yoga or mindfulness meditation. And I encourage people to seek the counsel of a therapist or a counselor to talk about their worries and problems. The second factor that most commonly contributes to worsening of tinnitus is sleep deprivation. Now, many people that have tinnitus report that they have difficulty falling asleep at nighttime because of the tinnitus. And for most, they find that their tinnitus is actually louder during periods where they're not sleeping well. So this tends to create a vicious cycle in which the tinnitus is interfering with falling asleep, and the less sleep somebody gets, the louder the tinnitus is. So what kinds of things can we do to improve sleep in the setting of tinnitus? Well, first of all, I think it's very helpful to use some nighttime white noise therapy. Playing some nature sounds, for instance, through a Bluetooth speaker at the bedside can be very helpful for many of my patients. Plus, I encourage people to learn about good sleep hygiene practices. So for instance, it's very helpful to try to have a consistent sleep schedule where you go to bed at the same time every night and wake up at the same time every morning. It's helpful to avoid screen time. So whether that's a phone screen or a tablet screen or a television screen for at least 30 minutes prior to trying to sleep at nighttime. It's helpful to avoid caffeine after lunchtime and to avoid alcohol in the evening times. It's also very helpful to create a sleep-inducing bedroom environment, a bed that's very comfortable with comfortable pillows and comforters, and to make the bedroom environment as dark as possible. I also encourage my patients to learn a technique called progressive muscle relaxation to help them fall asleep at nighttime. So the third factor that tends to make tinnitus worse in many people is focusing too much attention on the tinnitus. Now, we as human beings have the ability to actually change our focus of attention at any given moment. And I like to compare it to a spotlight on a stage when you're seeing a show at a theater. So at any given moment, our attention is like a spotlight. For one moment, we may be focusing on a person talking to us when we're having a conversation. At another moment, we may be focusing our attention on thoughts that are passing through our head. And still at another moment, we may be focusing our attention on lower back pain or some other sensation that we're experiencing in the environment. And what we observe is that people with tinnitus find that the more that they focus their attention on the tinnitus, the more they think about the tinnitus, the more they ruminate about the tinnitus, the more they worry about the tinnitus or fight the tinnitus, the more the brain feels like this is a signal that is important and worthy of monitoring, and the louder the tinnitus becomes. So we encourage our patients with tinnitus to try to focus on the tinnitus perception as little as possible. And I know that's easier said than done, but when we catch ourselves focusing our attention on the tinnitus or thinking about the tinnitus, we want to consciously redirect our attention to something else, to a thought or to another sensation or to another sound in the environment. And over time, patients will find that the less they pay attention to the tinnitus, the easier it is for their brains to designate the tinnitus as something that is not important and not worthy of monitoring, and the softer the tinnitus becomes over time. So again, I hope you find the content of this video helpful. If you have questions or comments, please leave them below, and I wish you the best. Have a great day.